And then I'll also start the recording too. And you are now live.
Thanks, Penny. Good afternoon, everyone, and welcome. I'm Dave Roth, and I welcome all of you, and I thank you for giving your time to this meeting of Health Equity and Access Response Team. This is the 6th time that we've come together since October the 30th. That's a good thing. We're building relationships and we're taking actions that are showing results. This meeting is a Zoom meeting. It's being live streamed to the public. It's being recorded so that all members can stay engaged. We ask you please be aware of background noises, mute yourself when not talking. And during discussion times, we encourage you to keep your video on as much as you're comfortable to help us get to know each other. We just had a little discussion about time that people need to depart this meeting. I'm suggesting that we aim for a 3:15 hard stop. That's an hour and a quarter, and we have a lot to get in that time. So we want to get the right balance of accomplishment, but make sure that we're getting all the input, all the feedback, all the discussion, because that's our core purpose. I remind you that we are the team that leverages our diversity to create new solutions so that as we respond to COVID-19, the entire community achieves optimal health and no one is disadvantaged. We're the team that extends our solutions beyond public health professionals. We're engaging businesses, healthcare, civic associations, human services, so that all of us are working to change our habits and ways of doing business so that everyone gets the best health possible. Third, we're using data deconstructed by race and ethnicity and other relevant identities to guide us. Today, we have 5 things that we want to do. We're going to welcome new members to the group, continue to build relationship and trust. We're going to update vaccination and building vaccination confidence. That's on everyone's mind. With high gratitude and appreciation. Oh my goodness, what's happened here? There we go. All of the folks who are here today are so appreciated, and we have gratitude for all of you and what you've accomplished. We also want to take some time today to think about who's not here that we want to bring in and include and engage. We're going to have an update on communication. We'll have an update on initiatives to promote PPE testing and vaccination, and then we'll confirm our next meeting date. So that's what we're up to today. Welcome. I want to first invite anyone who's come on to this call for the first time. Would you please help us get to know you? Give us your name, you're an affiliation if you're bringing one in with you, and what it is that brings you to this team. So I'm going to invite you to popcorn in at your comfort level.
Good afternoon. I will start. I am Reverend Morgan Dixon from DuPage AME Church, coming as a way of making sure that our congregation primarily, and certainly the community at large, the BIPOC population is included in the conversation and readily able to get access to the vaccine. Thank you.
Fantastic. Good to have you with us.
This is David Ware. I'm a member of DuPage Federation. Glad to be on with this conversation, and welcome Reverend Morgan.
Welcome, David. Let's see, I'm looking around for other names that would be a first time. Nina, would you introduce yourself?
Hi, everyone. My name is Nina. I'm a new intern here at DuPage Federation. So excited to be sitting in on this meeting and just learning what more I can do and we could do to help vaccine confidence.
Thanks, Nina. Welcome. Well, thanks so much. Is there anyone else who is coming in for the first time today? We would like to.
Hi,
Hi.
I'm Glee Lim. Sorry, there's something wrong with my video, but I work for Navistar, and Chris Huff actually invited me to join this group, and I am happy to know more about what we're all about.
Good. It's good to have you here, Glee. Welcome.
Thank you.
Are there others? All right, good. All right, it's nice to have new additions to the group. Welcome. And what I'd like to do now is bring to the microphone Chris Hoff for a brief vaccination progress update.
Yes, thank you, Dave. Let me get the screen up and confirm with you that you can see it.
We are able.
Okay, and do you see a full slide or a presenter view?
A presenter view.
Okay, I'm gonna check this time because I think I short shrifted everybody last time by not showing the full slide. Is this the full slide?
Yes.
Okay, excellent. Well, thank you. My name is Chris Hoff. I'm the Director of Community Health Resources at the DuPage County Health Department, and appreciate the opportunity to provide an update on vaccine and the efforts to get vaccine out to our community. Some of this is repeat for those of you who have seen it, so I'm going to zip through some of these pretty quick, but you'll have the slides to be able to continue to use these with your clients, stakeholders, partners, and community. So a reminder that COVID vaccines are one of the tools we have to fight the pandemic. There's obviously a lot of excitement and enthusiasm about vaccine, but it's clear that we're not going to have enough vaccine in the very short term to vaccinate everybody. So we want to remind people that we still have things that we know work. Masks are a very effective tool for cutting down on transmission. Physically distancing yourselves from others, avoiding large indoor gatherings with lots of people. These things all work. And so we shouldn't just kind of throw up our hands and say, well, I can't get vaccinated, so I'm not going to do anything. No, we really need to take control and to use the tools we have and remind people that these are really, really effective until we can get everybody vaccinated. And a reminder that even after you get vaccinated, that we still need to wear a mask and keep our physical distance. We're learning more as more people get vaccinated about how well these vaccines will prevent transmission between people. We know the vaccines prevent you from getting severely ill or dying as a result of your COVID infection. We don't know yet enough about how well they prevent transmission. So we're going to need to wear masks and physically distance. And I think it's helpful to know that as you wait to be vaccinated. I think there's some perceptions that, you know, when I get my vaccine, I can take this silly mask off and go back to doing all the things I did back in 2019. And that's just not quite the case yet. We're very excited that we're going to get there, but want to help kind of manage expectations for people that are anxious to be vaccinated. With that said, vaccines are one of the best ways for us to get back to normal. So we want to help build confidence in the vaccine. We're all here today to talk about that. And you'll see more tools from us about how to do that. Sample material you can use with your communities and make sure that people understand that these vaccines are safe, effective, and that they will help us to get out of the COVID pandemic. To head off any questions people have now. We don't want to wait until there's enough vaccine to answer these questions, right? We want to build confidence so that as vaccine is available, more and more people are comfortable being vaccinated. In terms of our goals of what we're trying to accomplish with our vaccine program, the DuPage population is just under 1 million. The vaccines we have currently are generally for adults 18 and over. The Pfizer vaccine does allow us to vaccinate 16-year-olds. But if we look just at that 18 and up population in DuPage, we're looking at 572,000 people that need to get a vaccine. And in the case of the vaccines we have today, they'll need 2 doses. So we need over 1 million doses of vaccine to get to that population with the vaccines we have today. One of the things that is coming up a lot, and we want to help communicate and share with you so you can share, is that a lot of people expect that we're only going to be setting up these mass vaccination sites. And whether it's a distant memory of polio or some long ago epidemic where we needed to bring people in large lines and we had plenty of vaccine, or even as recently as H1N1, where we had thousands of people standing in line at vaccination sites. Now in COVID, we have a very different situation, right? We're wearing masks. We're very cautious about physically distancing. And so our strategy here in DuPage is to push vaccine out to as many community providers as possible so that there are lots of access points and where we're not reliant on 1 or 2 major sites to bring people together. And so you'll see in our material more and more sites coming online with vaccine and being able to administer vaccine in a safe and controlled environment. Answering the question, where will I get my vaccine? I think it's hard when you don't have big sites. If you don't have a mega vaccine site, it's fair to wonder, well, where are these vaccines going and where am I going to get vaccinated? And so as of yesterday, we had 89 different providers in DuPage who are approved by the state to receive and administer vaccine. They include hospital-based clinics. They include more and more retail pharmacies every week, more outpatient providers, working with employers where it's possible to have them vaccinate. And the health department is just one of those providers that's administering vaccine. So we have a vaccine clinic through the health department. We're expanding to the fairgrounds site in Wheaton here in the next few weeks. But we're one piece of that. And so you really have the opportunity to get vaccine at any number of these employers as the supply of vaccine catches up to the number of providers that are willing to provide it. This shows you just the geographic distribution. This is a point in time, right? So we're adding providers to this every week. But the idea is that we have providers all over the county that have expressed interest, that have agreed to provide vaccine, have worked through the logistical the considerations through the state to be approved. And while they may not be open sites that somebody can drive up to or get an appointment at, vaccine is going out through many of these right now. And about 42 locations are getting vaccine from us and administering vaccine to their employees, their patients, some community-based appointments, and you'll see more and more of this over the coming weeks. So how are we doing? I think there's a lot of attention and questions and media attention on vaccine that is sitting on shelves or being wasted at the end of the day. We are working so hard to make sure that doesn't happen. And we've had an incredible success in getting vaccine out to our population. It's not enough. We have many, many thousands of people to go, but I think important to recognize the work that has been done and all of the partners that have played a role in that. So we're currently receiving about 13,000 doses of vaccine every week from the state. It's an issue of how much gets allocated to us. So we can't just request as much vaccine as we want. Hopefully everybody has seen that the supply of vaccine is tight around the country. So what we are doing is that when we have control of that vaccine, we're doing everything we can to make sure it gets out as quickly as possible to the people that need it. And to date, over 65,000 doses have been administered. Almost 18,000 people have 2 doses in their arms and are fully immunized. And that means that about 50,000 people in DuPage have had at least 1 dose of vaccine. It's almost 10% of the population we're trying to reach. So really, it's moving. It may not feel or look like it's going fast enough, but these are vaccines going into arms, building protection and getting us back on track. The link is here to track this daily through the IDPH dashboard. So you can keep an eye on it. You can hold us accountable. You can help share with your community. I think it's important to help people understand that vaccine is going out. You see a terrible story about what's going on in North Dakota and you assume well, I'm sure that's happening here. We want to dispel that and say we're working, every day to get vaccine into more people as soon as we have it, and working with all these partners, hospitals, pharmacies, clinics, the health department sites to get vaccine to people as quickly as possible. This is data from today, and this just shows the collar counties. So you can see on the IDPH website across the state how everybody's doing. We've pulled kind of the Chicago metro areas. These are the counties that we're most likely to cross over with. And you can see that DuPage is right behind Winnebago in terms of the percent of our population fully vaccinated. And that's ultimately the goal, the outcome we're shooting for, is to get as many people in our community fully vaccinated against COVID. So I look forward to the day when we look back at this 1.94% and laugh at how small it was, because we're sitting at 90%. But it's important to recognize success along the way and recognize that vaccine is getting into arms. It is getting into people. And DuPage is really, I'm proud to say, leading the way across the Chicago metro area, and is a testament to the providers and the system we've built here in DuPage. This is not just the health department. This is hospitals. This is pharmacies. This is outpatient providers. We're really working hard to get that vaccine out there. In terms of the time frame, I think we talked about this last time, but just a refresher, now that we're we're transitioning into the 1B phase. I think the last time we met, we were still squarely in 1A. 1A was focused on healthcare workers and congregate care staff and residents. Starting on Monday, the 25th, we started to move into the 1B phase. So that means we're continuing to vaccinate people in 1A. And we still have lots of people that are raising their hand to say, hey, I meet the 1A criteria, and we're prioritizing them to get vaccinated, but we also want to make sure we're moving on as we have the vaccine to do it. So we've started to vaccinate frontline essential workers and those age 65 and up. Now that group is huge. It's about 270,000 people. And so when you think about the fact we're receiving about 13,000 doses a week, it's going to take us several weeks and even a couple of months to get through that whole group. So we really want to help people understand that just because we started that 1B doesn't mean there's enough vaccine to do everybody in that group right now. We would love to. I would love to be sitting on 268,000 doses of vaccine and get through them in the next 24 hours, but we just don't have that vaccine. So we are working to get vaccine out as soon as we have it, and we'll move as fast as the vaccine supply allows us. Our goal to get through that 1B population in 12 weeks is really assuming that we get about 18,000 doses of vaccine. So we already need more than we're getting. So we just want to try to help everyone understand why we're saying that 12 weeks. It could be faster. If we get much more vaccine, we're going to go as fast as we can to get people vaccinated. But we get a lot of questions from people to say, well, I don't understand, why can't you work more hours or work more days or stand up more clinics? Right now, we're really limited by the vaccine, and that's in short supply across the whole country, unfortunately. So we're advocating to get as much vaccine as we can get here, but it is a finite supply. There's only so much, and we really ask for your help in helping people understand that. Right now, vaccination sites include all of these different places, and over the 1B population, there will be more and more vaccine available through these entities. The vaccine supply, in addition to being short from what we want, is also variable. So I think you'd assume if you were planning this, if you sat down to develop a perfect system, you'd say, well, I would want to make sure we've got the same amount of vaccine every week or an increasing amount over time so I could plan how many appointments to have. Unfortunately, that's not the system or the cards we've been dealt. And so we've seen vaccine go from 5,000 doses in a week up to 24,000, and now this week back down to 12,000. So it's really creating a challenge for scheduling appointments and getting easy communication to people about how and where to go. The new administration has promised to get us to a 3-week forecast on how much vaccine to expect. That will definitely help us be a little bit more clear in our planning and communication. But we're also committed to sharing the information we have and being honest about how much vaccine has shown up here in DuPage County. How we transition between phases. We've had questions this week from people that are still in the 1A group saying, hey, you haven't gotten through all of us. Why are you moving on? We look to start to transition between those phases when the demand starts to peter off in the first phase. So we had gotten through a large majority of the healthcare group. We absolutely want to keep prioritizing those folks and make sure they get vaccinated. But we don't want to be in a position where we're standing there for 3 or 4 days ringing the bell saying, okay, anybody else, while there's a group of people that are ready for vaccine in 1B, ready to go. So we've started to transition into 1B, and we'll continue to vaccinate those people in the first group as we go. Who can provide vaccine? We've had a lot of questions from community-based groups saying, or organizations, asking to have vaccine sent to them. We want to be clear that the vaccine still is a medical product, so it has to be administered by a licensed healthcare provider. There are some stringent requirements in place. We're working with as many organizations that have the ability to do this as possible. Again, we have a decentralized model, so our goal is to get as many providers capable of doing this as possible. If your organization can do this, or of an organization that can, let us know, and we're happy to work with them to make sure that they have the ability to be set up appropriately. In terms of the allocation, we've had some questions, so just to shed some light on the process. Each week, the federal government makes an allocation to each of the 50 states. The states, in turn, make that available to the county here. So IDPH tells us once a week what our allocation is for the next 7 to 10 days. And then we work very quickly to make sure that vaccine is available to all of these different providers out there. But our planning horizon is about 7 to 10 days to get these providers the vaccine they need to vaccinate. Next, to address questions about the priority groups, we've had a lot of questions about, who's making these and can we move people between the groups, or how do I advocate to get higher on the list? The recommendations about how to allocate vaccine when there's not enough supply are made first by the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, and then they're adapted a little bit by states to fit their specific needs. But the goal is really to have as national or a state level priority as best as possible, so you don't have Kane County doing one thing, DuPage doing something different, Lake County doing a third option, and it just really confuses people. So I know there's frustration out there about, every time somebody makes a change in one place, it has a domino effect on all the other places that are vaccinating. So we're working hard to try to balance that. One question we've gotten a lot is, why are we doing seniors and frontline essential workers? These are the recommendations from the CDC's advisory committee that really, looked long and hard to try to, put our values into writing. When you're allocating vaccine, it's not just a math problem. It's about committing our values to paper and saying, we're trying to balance the need to protect both those people at high risk of disease, who are at increased risk for severe outcomes, but we also need a functioning healthcare system. We need a place to buy groceries. We need a place, we need to take care of the workers who care for those older individuals. So we're trying to balance both of those things. And I think what you feel right now is the fact that there's even less vaccine than we want. And so trying to do both of those things is really tough. But our goal is to get vaccine out as quickly as possible to as many people as possible. And remember that there's only so much vaccine. So every group you move up doesn't mean that anybody's going to get vaccinated faster. It just means there's more people now fighting for the same number of vaccines. So just help us communicate that and help people understand that we're trying to get everybody vaccinated as quickly as possible, and don't have enough vaccine to do that right now, but we're committed to moving as quickly as we can. Some examples of the 1B group. I think we've talked about this in the past, so I won't stick too long on here. We'll share the slides so you can ask questions or we can come back to these. But just to wrap up, over 65,000 doses have been administered. We're pushing vaccine as fast as we're getting it. The health department is currently in the air traffic control role of getting vaccine to the appropriate providers and making sure they're standing up clinics. The health department is vaccinating people through our own clinics, about 1,500 to 2,000 per week. And we'll expand to a different site at the fairgrounds in the coming week. But that's just kind of relocating our existing clinic out of our building here to allow us to do some other more normal activities while we continue to vaccinate and expand. But thousands of appointments are being conducted through health systems, pharmacies, and other providers every week. And right now we're working to finish the 1A group while we transition into 1B and get those folks vaccinated as quickly as possible. In terms of getting information, the number one place that we're recommending is people sign up here, DuPageHealth.org/COVID-19 vaccine. That allows us to push information directly to people as appointments become available, whether that's an appointment through the health department or through Walgreens or through a hospital. We're working through that list to communicate updates and specific information about appointments as we have the vaccine to do it. I'm happy to take any questions or follow up afterwards for those that are interested. Thanks, Dave.
You mentioned health systems, of course, as being one of the main distribution sites. Are any of our FQHCs here in DuPage County administering vaccine yet or in the pipeline to do so?
Yeah, are any of them on? Let's wait and see if anybody. So yes, so from a distribution standpoint, yes, Access and VNA and Hamdard are set up to receive vaccine and distribute. They're working through their capabilities to be able to do that. We, as we have the vaccine to allocate, we're certainly supporting any provider that's requesting vaccine. So yes, they're ready to go and defer to them on their ability to schedule and work with their clients.
Chris, thank you for an incredibly thorough and clear presentation. I see 3 questions in the chat. One has to do with, can we share the PowerPoint in our workplaces?
Yes, you could share the PowerPoint, and I'm going to link, I'll put that file in the chat, as well as one other link to our education and outreach tools. Kim, we'll talk about this later, I'm sure, Kim and Mila, communications group, but we're happy to get as much information out as we can to help people understand the process.
Good. The second question is, where are schools in the vaccination strategy?
Yeah, great question. So schools are, educators are part of the 1B group. And so that group of professionals represents about 30 to 40,000 people in DuPage County. So they're part of that 1B group. We are working with the districts to connect them with vaccine providers to be able to organize vaccination for their employees. And same issue is with everybody. We don't have enough vaccine to do everybody all at once. So it'll take a period of time to get that group fully vaccinated, but they are in 1B.
And then final question, can you point us to science on double masking?
I think Dr. Chug is here. I'm going to turn that one to her, if that's okay. Dr. Chug?
Yes, hi. There's no official recommendation on double masking yet, but generally, if a single mask, like a surgical mask, has 3 or more layers, then that's certainly aligned with CDC recommendations. But yeah, no official statement on double masking, but the general methodology of more layers is good. But if it, again, a single mask is fine if it's 3 or more layers, ideally. Thanks. We'll certainly keep you posted because I know there's a lot of buzz about double masking right now. And I think Dr. Fauci also recently chimed in on that as, you know, a common sense solution, but CDC has not commented on that at this point. But we'll keep you posted. Thanks.
Good.
Chris, can I ask just one final question? We're going back to the schools. Is there a plan, and I understand the logistics of refrigeration and whatnot, but is there a plan to utilize our universities and colleges to have health science programs, specifically nursing or medical programs, to use these students and perhaps even some of the instructors to help with the vaccine?
Yeah, great question. So we, through the health department, are using some of their staff, nursing students, to support the vaccination efforts. I know Midwestern University has become a vaccine provider and will be doing some vaccination efforts. We're happy to work with anybody that's out there, and we're going to need vaccinators over time. In the short term, we have lots of providers and lots of sites. We don't have enough vaccine. So yes, it's happy to work with anybody. And if you've got recommendations or programs you want to connect us to, or that may want to become their own sites, we'd be happy to work with them.
And Chris, just to add to that, some of those sites may not have gone through the process with the state yet, and that takes a little bit of time. So this is a good time for them to do those things.
Yep.
All right, so before we move to vaccine confidence, I do see another question coming in from Lynn. Word on mass production of N95, KN95 masks to help battle.
I can start on it. Dr. Chu, you can jump in. We've heard that the new administration is looking at the Defense Production Act and some other tools to help increase vaccine production and things like masks. I haven't seen anything specifically tangible that's useful, but yeah, those are important tools in reducing transmission. Dr. Chu, anything you want to say about that?
I agree. I've heard the same, that that it's been prioritized because it's recognized as a need to increase supply of N95s and other personal protective equipment. Thanks.
And part 2 on that question is, with school sports starting, does the health department have advice for parents and athletes?
I would say in general, as things reopen, you know, we've brought our positivity levels down, cases are coming down. So we're excited about those trends, but also, a word of caution that, we're not going to go just because we're headed down right now doesn't mean that we're headed down to 0 and we're out of this, right? We saw cases come down in previous waves and they stayed down, but it's going to take all of us continuing to work together to, wear our masks, keep our physical distance to the extent that we can, avoiding those large indoor gatherings. So I think it's, safer to engage in some of these activities as the case numbers come down, but we have to be prepared that, we're not out of this yet, and we're a long way from having everybody vaccinated. There are variants of the virus on the horizon. There's, lots of reasons for optimism, and we want to be that beacon of hope, and also caution that, we're not done with this yet. Dr. Chug?
Excuse me, I would agree that even in our school related activities and outbreaks, I mean, many of our cases have had other exposures, such as in their household, but the outbreaks that we have identified related to school transmission have largely been related to athletic activities. And then folks may have heard about the recent CDC's Morbidity Mortality Weekly Report that looked at 17 schools in rural Wisconsin, where they were funded by a private grant and were able to improve, with additional resources, have smaller groups of students or pods that were physically distanced and had improved ventilation. And even with those, they were generally able to have lower school-related transmission, but what transmission they had was related to athletic activities. So it makes sense where you can't physically distance, there will be increased risk of transmission. So like Chris was saying, proceed with caution, and if possible, better not to proceed in activities that are a setup, frankly, for transmission. So thanks.
Thank you. And I skipped over Reverend Miguel's question about churches. Reverend Miguel, perhaps you were asking about that PowerPoint. Could it be shared in churches, or did you have a broader question there? You're muted for us.
I'm sorry, I want to look at the PowerPoint. I think we're going to find the answer in there, because I want to define if it's part of the group A or B, you know, and also find out the programs the church have, you know, with special daycare programs. I wonder if they can be applied, or different kind of programs that they have, you know. So, but I'm taking a look at the PowerPoint, unless Chris got the answer for now. That'd be great.
No, I'm muted. Yes. So for churches, it depends. Like on the school, if you have schools related to churches, those are definitely educators. But the different functions, we kind of look at the functions that are performed versus the overall organization. So looking at that 1B, 1C list to see how those different areas might match up. So education is definitely there. There's not a specific call out, I don't believe, for churches per se, or faith-based institutions. The functions about defining 1B and 1C are more related to the different occupations or sectors that people may be working in. But yeah, if you don't see it on the slide or there's a question, happy to follow up.
Very good.
I
Thanks,
apologize.
Chris.
I want to make sure that I got this. This is Kara. I do not envy you guys this particular task, but I'm curious, as we ramp up the number of sites that are capable of delivering vaccine, but we don't see the same ramp up in the number of vaccines that we're receiving, how do you guys decide how to allocate that limited vaccine across all of those growing sites?
Yeah, it's an excellent question. And so we have tried to put together an allocation framework that, regardless of how much vaccine we get, guides us. So one principle is trying to get vaccine to as many providers as possible. So there's equitable access in geography and type of provider and type of access. And then looking at, reducing kind of equitably across the board. So if we have to reduce everybody's orders by X percentage to get down, we will. But we're trying to, the number one principle is to try to get vaccine to as many providers as possible, knowing that not everybody gets, healthcare or vaccine from the same provider, or, centralizing that may be easy logistically for us, but doesn't necessarily serve the aims of getting vaccine to as many people in as many places as possible. But it's a great question, and it will be tough as we struggle to get enough vaccine, and there's not, I wish we could snap our fingers and say, we want more vaccine, and we're advocating hard to say we can do a lot more. So if there's vaccine that's not being used, send it our way. But I know that the reality over the next few weeks, at least, will be that we won't have enough vaccine for the number of people that want it.
Chris, how are you factoring in equity in the distribution?
Yeah, that's part of the reason to try to distribute it to as many providers as possible. So trying to make sure that it's balanced across all the providers. Any provider that is registered and approved, we are sending vaccine to. If they're ready and requesting it, that's a consideration. We're not at this point, weighting allocation to providers based on case rates or deaths. There's, we're so early in the process that just trying to get it to those providers so that they can open access has been kind of the first principle. But definitely something for us to look at as we get vaccine and the effort goes on.
And I would just add that we are particularly trying to make sure that communities that were most disproportionately impacted have access, and also to support the needs and hopefully over time expand capacity for our federally qualified health centers and community health centers and areas that provide broader access across the board. Thanks.
Okay, so and what I'm hearing then is that there is some effort to consider in the distribution those communities, particularly those of color, because we're getting to the elderly by vaccinating those in long-term care facilities. What I'm hearing is there is some effort to make sure that those communities most impacted, Black and Brown communities, are having access to the vaccines.
Yes.
Okay, thank you.
Yep. And if you've got other providers, again, this is the recruitment part. So our goal is to get as many providers on board as possible. So especially if you're familiar with providers that, may treat individuals in those populations that you think may not be enrolled or may not know how to do that, let us know. We're more than happy to help people get through that process so that they can get the vaccine. Not every provider can, you can't just wave your hand and say, you send me some vaccine. There is a process to make sure that people are able to store and handle the vaccine or accountable for it. But we're more than happy to help providers get through that if there's any question to make sure that they can take care of patients in those populations.
Chris, if I can piggyback off of what Janice and also Pastor Miguel are saying, and what I'm hearing them say is we chime in with that also as a way to do that. How can the churches and other non-traditional locations be helpful in that effort? Because that is, we're disproportionately affected by this virus, and we don't want to be left out because we don't go to these qualified providers.
Mm-hmm. Yeah, so one is communicating with people on where vaccine is available right now, and to the extent that we can help do that, registering with us, making sure people know how to sign up and where to access. Right now, that's probably the easiest thing because I don't know if I said it during the presentation, but we're probably a few months away from being able to just stand up, moving clinics around. We have so little vaccine and there's such a tight control over that we're not ready yet. We've got plenty of sites and providers. We don't have enough vaccine. So in the very short term, helping people sign up, whether that's through us or, navigating them through their healthcare providers. A lot of providers, if you are getting care through one of the larger networks, they're starting to contact their patients. So preparing your members, your church folks that, here are the different ways you might be able to access, and making sure that they have the same information other populations do is probably the easy short-term solution to do that.
Chris, this might be a good time to talk about the expanded efforts of the call center and having the Spanish sign up on the website.
Yeah, so, initially the sign up was very focused on an online form, sign up, indicate your interest. We know that doesn't get to everybody. So we're on the brink of launching a call center that will be able to take calls from people that may not be able to go through the website. We are making that available, and that'll be a Spanish resource too. We're posting information and resources in a couple of different languages on the website about the form itself and information about vaccines. So if you're looking for something and don't see it, let us know, but we're really trying to make an effort to get to people regardless of how they can access the registration.
Once we have more information on that, if there's a way we can provide you something for your church bulletins or for your social media efforts, we can talk about that and, work through the best way to communicate that if we're not doing it already.
So I'm sorry, has that launched already? The call center?
Not yet. People can call us at the health department right now, but we'll be launching a more broad effort to get people to call. We know that as soon as that's out there, we'll have tens of thousands of phone calls. So we want to be ready to handle that and not put people in a position of calling and waiting for hours. So we want to do it well.
Okay.
And this is
Chris, sorry, this is one of the questions I have, one from the Latino community, because they saw already in the health department website the registration for vaccine. So they make the registration, but how is that working? It's not clear. They're gonna send an email who's gonna be apply for this registration. There's many questions about that.
Yeah, so the registration form, we're asking people to fill up and give us some information on the front end. That allows us to communicate with people when vaccine is available. I think that's one of the biggest, questions we've had from people is, I'm trying to sign up for a specific appointment or day. And so the sign up right now, because there's not enough vaccine, and we don't want to schedule people for vaccine that we don't have or we end up not getting and then have to reschedule them for June because we had to cancel their appointment. We're trying not to schedule those appointments right now. So we have over 141,000 people that have signed up on that registration form. So we're moving through that kind of chronologically to take people and send them, whether that's an appointment through the health department or through a hospital that's running a clinic or a pharmacy. That's how we're using that list to get information directly to people when there are appointments. And I totally understand. I wish we had a system that you could just schedule a time and a date. But we know that, you've seen stories where, places have done that and then, they had to cancel 20,000 people because the vaccine didn't show up that week. Boy, I'd hate to take people who were scheduled this week and say, okay, well, the next available appointment is June 6th. Sorry. So we really want to try to manage, what we're telling people, help them understand what to expect. So to the extent you can help us communicate that or communicate it better, if you have suggestions, we're open to it. We want to do it quickly, but we also don't want to put people in a position where they get bumped and bumped and bumped again and end up in the same boat.
This is Rashmi. I also just wanted to reiterate what Chris was saying, that this is the perfect forum for us to hear from you as we identify and expand our provider sites and do that intentionally and deliberately. We also want to hear from you if there are locations or pockets that are not yet gaining access. We absolutely want to prioritize those areas, particularly if there's not, so as Chris said, if there are provider groups or or health centers that would like to provide vaccine and just need a little bit of support, we want to help walk them through that, and then so that they too can become a provider site, a vaccine provider site. And then also, as we have as IDPH ramps up on mobile vaccination capabilities, then we can also prioritize those. So this is exactly the forum. We don't have, again, just limited by vaccine supply right now, but we are optimistic in the coming weeks that we will have these resources available, and with your help, we'll be able to better direct those. So thanks. Please keep the feedback coming. Thank you.
Yeah, definitely. Thanks, Rashmi.
So I have one more question. My name is Sophia and I work for Schilling Association. So we serve like hundreds of Chinese seniors, and they all based in DuPage. So like Chris said, we're really looking forward to seeing a web page in simplified or traditional Chinese that can direct the seniors to register and to get more vaccine update. I think that'll be really, really helpful for the minority, the minority community. And also for Dr. Chu, what is the best advice to send out to our seniors as to guide them to get the vaccine? Should I tell them that please check with your PCP, or just register, or online, or register on Workgroup? I'm trying to, to differ the advice that I give to them, or it's pretty much the same for everyone else at this point?
Sure. Well, for seniors, they're very much in 1B, which we have just begun. The health department is actually, as Chris said, we're still trying to work down our list of our healthcare personnel in phase 1A, but 1B, we have community providers that have already begun. And that certainly includes our 65 and older population. So you were listing those different options, and the answer is all of the above. We would like them to sign up through any mechanism they have access to, whether it is our health department vaccine page, or through their health system or primary care provider, or through their local retail pharmacy or pharmacies, because that way, as soon as they wherever they come up first and can schedule an appointment, they should absolutely go for it. That's just currently the environment we're in until we have enough vaccine supply where everyone has vaccine, and then they can pick and choose, like Chris was saying, where we have that sort of standing availability. So that's, Chris, anything to add to that? Pretty much all of the above, right, for now? Yeah, definitely. If you can get vaccinated, get it. We're working on a better system to get everybody all at once. But in the interim, you may get a text from your provider saying, sign up here. Walgreens, I know, is reaching out to some of their clients, their existing pharmacy clients. So I think preparing your clients, your partners, that they may get outreach from any one of those, and anyone is okay. Don't wait for one over the other. If you have the opportunity, I think it's helpful to educate people that you might get outreach from any number of those. And unless you have questions about it being a legitimate provider, go get vaccinated.
Thank you, Chris and Dr. Chu. Thank you, guys.
May I clarify, Sophia, you mentioned looking forward to a web page in Chinese, and for my sake, I want to understand, were you thinking about one that you know that's in development, or is this in partnership with the health department? I want to.
Yeah, Dave, as you may aware, because we have clients like all over the state. So from my research so far, I have found, let's say, Cook County Health Department does provide multi languages, and including City of Chicago, because we also have clients there too. But so far, I haven't found that resource in DuPage County yet. That's why I raised that question, because I really do think it's going to be really, really helpful. Because our seniors, they are like definitely with like limited English proficiency category. So the language is a big barrier. So yeah, so our team has been translating. I personally myself have been translating word for word from DuPage Health Department and make sure that the seniors got the exact message from you guys, but in Chinese. Yeah.
Hi, Sophia. It's Kim Siebert with the Health Department. You may not be aware, it's a small button on the bottom of our webpage. There is a button that you can choose a language
really?
to translate the site in. So we do have Chinese simplified and Chinese traditional as an option.
Oh, cool. Would you please share that? Because I'm looking at a lot of websites. So which one are you talking about?
So the main health department site, and if you go, it's on all of our pages. But in particular, if you go to our COVID, if you're interested in COVID vaccine, okay. Here, you know what? Maybe it would be easier if I shared my screen.
That would be great. Thank you.
Okay, hold on. Bear with me here.
And while she's sharing screen, I want to note that we are going deep into a conversation that's entering into the time we'd set for other agenda items. This is so important. We're making fantastic progress. So we're going to figure the rest out, and we'll stay with this until we've exhausted it.
Okay. Can everybody see my screen?
No.
No, you cannot. Okay. I thought I was right on track here.
Not yet, Kim.
Here it comes.
Here we go. Yep.
Okay. All right. Okay. So do you see this at the very bottom where my mouse is on the lower right?
Oh, select language. Got it.
So you can choose the language. So we'll choose Chinese simplified. And it translates the website for you.
Oh, okay.
And it should translate all of the communications on the site. So let's just see. It looks like you might have to hit it though. You might have to, oh no, there it goes.
So Kim, would you carry that through for the registration? Can we make sure that form will also translate?
I need to look into that technology. So definitely, yeah, I think we can actually. I think we can. So yeah, let me get back to you on that, David.
That would
Very
be
good.
really awesome. That would be really, really helpful. And this morning, our group also got a multi-language frequent question and answer flyers from IDOA. Just very, very simple question about COVID-19. And I also share that with our clients as well. So.
And Sophia, let me also just call your attention. Oh, I'm sorry. I stopped sharing my screen. Hold on.
That's fine.
Can you see my screen?
Yes.
Okay. So if you go again to our main COVID page and click on education and outreach right here. That will take you to a web page that has all of our communication resources on it. We do have quite a few, like our primary fact sheet that we're promoting right now is our best shot against COVID-19. It's available currently in 5 languages, and we have it being translated into a few additional. So there are available languages already. If you, just take a quick look. And if you come across anything else that you feel is very important for your community, let us know. We're happy to work with you.
Thank you so much.
Very good. Thanks, Kim. Let's see, that was related also to this question of the registration. I did want to make sure, as we have folks who are coming first time on the call and who've been with us before, I just want to be sure that everyone is aware that there is a way to register through the health department website so that you can get a weekly update on the status of all things COVID, and so that you can be registered for information about vaccine availability. And you'll, if you've signed up on that, you're aware that you'll get a periodic message back to you telling you what the status of things is. And so that electronic registration is in place. Today, we're having conversations about a call center that expands our ability to do that as well. I'm imagining it's always going to be in our interest as much as we can to stay electronic, so that we don't overtax the systems that are slower and more people intensive. We reserve those for the folks who don't have electronic access, so that they're not burdened by people who could use electronic but aren't. Wow, that was great conversation. Is there, does anybody else have a burning follow-up, something that relates to this? And if not, what I want to do is invite Kara and Mimi to keep the vaccine confidence conversation going.
Happy to do so. Kara and I are going to share, for those who aren't familiar, about a week ago, I think it was, WBEZ had done a webinar for the Latinx community, and they had some great discussion, great questions. And as part of that, they had also distributed a survey out to the community. And we thought that something aligned with that could be really helpful in DuPage, looking at attitudes around the COVID vaccine, intentions to get the vaccine, concerns that might need to be addressed, and also motivators. So looking on the positive side, what would motivate people to get the vaccine? I'm going to share my screen so folks can see some of the findings from this survey. And then I would like, we'd like, if we could, to discuss how this might be applied in DuPage. Can everybody see my screen? Okay, great. So this is the slide deck that Esperanza was nice enough to share with us. As you can see, they just did this, collected this data a few weeks ago. So not surprisingly, given the population they were trying to reach, it's combined largely of both Spanish speaking and English speaking Hispanic and Latinx population. And the first question they asked was around attitudes around comfort with receiving the vaccine. And you can see here what they did was they broke this out by strictly among the people who were comfortable, somewhat or very comfortable getting the vaccine, and how many people endorsed that, both by language spoken and age range. If you look at this, you can see it almost looks like an upward trend. As people get older, they're more comfortable with it. And Spanish speaking slightly more comfortable than English speaking. So that was kind of the first area they assessed, was looking at comfort level. I'm going to try and move through these a little bit quickly in the interest of time, since I know we're already approaching 3 o'clock. Now, the next question they asked also was looking at intentions to get the vaccine. And we know that behavioral intentions are a good predictor of actual behavior. So that's important when we're thinking around the vaccine, who would actually be likely to go ahead and get it. Again, this is going to be people who endorsed that they were somewhat or very likely to get the vaccine. And you're going to see a similar trend here as people are, advancing in age, a little bit more likely to get it. We could hypothesize why, in terms of, possibly more severe outcomes for older people driving that likelihood to get vaccinated. And then we also, they asked about questions folks have about the vaccine. And I think for us in particular, when we think within the communications group, we keep wanting to ask, what are the concerns and questions people have? So as we're developing messaging, as we're developing communication, we can address those concerns and help people feel more confident about getting vaccinated. So looking at this, you can see some of the largest questions are around, in my mind, what I think is kind of a good thing. When can I get it? How long will it protect me? To me, these kind of indicate interest in wanting to get the vaccine. How much will it cost? How accessible is it? And then a range of concerns or questions around, maybe more education or information people need. Is it safe for chronic health conditions? Will it interact with medications I'm already on? And then in addition to concerns, they also ask, what questions do you still have? And here in this slide, what you can see is they took those people who were likely to get the vaccine and compared with the people who endorsed that they were somewhat or very unlikely. So those are the folks, when you see that kind of line, the little ball at the end, that's showing us the difference between the likelies and the unlikelies to get the vaccine. And knowing this can help us target our messaging as well. If we know who is more likely or less likely to get the vaccine, we might tailor our communication based on that. Again, here's concerns about the vaccine. A lot of concerns around predominantly side effects, safety, will it be effective? And to me, these are all areas that maybe we would need to shore up better or more communication around that if those are concerns that are still being voiced. And again, you're going to see here, looking at the unlikelies or somewhat or very unlikelies, how different are their concerns compared to those who were likely to get the vaccine. You can see a little more concern around side effects, definitely more around safety, how it was developed, is it effective? So again, having all of this type of information can help us tailor our messaging and our thinking of how we communicate with folks. This next piece gets at what I would call, who are the influencers? Whose message do we trust about getting vaccinated? In this case, folks were really on board with information from their doctors or their healthcare providers, from public health experts, from family members. You can see it's not highlighted as much in the bars, but at the bottom of each of these charts, they did also ask about other potential folks that might influence their decision-making, friends, elected officials, religious figures. It's quite possible that this could vary based on who we ask, but for the purposes of this survey, largely those healthcare providers and family members were predominant influencers or people that they would listen to their message about getting vaccinated. Now this next one, when I first looked at it, I thought it looks a little like spaghetti. So let's walk through this one together. For this one, what they were looking at was for the people who are somewhat or very unlikely to receive the vaccine. So among those groups, how well does kind of a public health message resonate that when the majority of folks get vaccinated, the pandemic will end? And what they found in this survey was that the people who are less likely to get vaccinated were less likely to endorse that idea that the pandemic will end when more people get vaccinated. The reverse was true for people who were likely to get vaccinated. And then this, looking at what would motivate folks to get vaccinated. What are you looking forward to when the pandemic ends? And I think this could be a great source for messaging and communicating with folks to hopefully influence people in a positive way for vaccine uptake. So seeing family, socializing with friends, going back to work, sending kids back to school. And here you can see it's broken out by age range, and some of that's going to vary, not surprisingly. You know, middle-aged folks want to send their kids back to school. Older folks are looking forward to seeing family that they've had to quarantine from for a long time. And then importantly, when we think about where are we going to distribute health information, where are the most, where do we get our most bang for our buck, if you will, in terms of sharing out information? Here you can see the sources indicated. It looks largely like television news was more important with folks who are a little bit middle-aged or older, social media, websites with folks who were younger, and a little mix in there. And then there are some additional slides here. These are some word clouds with the idea here with the larger the text indicates a stronger response. More people endorse that type of response. So you can see activities folks are looking forward to, returning to a normal life, travel, work, seeing family. And then questions and concerns about vaccine development. Was it too quick? What are the long-term side effects? Why do I need 2 shots? And then this type of graphic I think could be really helpful to think about as well, in terms of what they did was they took by grouping how comfortable people were with the vaccine. So somewhat comfortable, somewhat uncomfortable, or very uncomfortable. And then looked within each of those groups, how likely were folks to get vaccinated? The somewhat comfortable group, I call them the on-board group. Almost everybody said they were likely to get vaccinated. That somewhat uncomfortable group is more the fence sitters, if you will. They're not sure if they want to get the vaccine or not. And the very uncomfortable group I would, categorize as we're not having it, we're not on board. So when we look at something like this, again, if we're thinking about communication and messaging and how's the best way to reach folks, we can think about tailoring our messaging based on that response. So really, we share this just as a starting place. We would like to be surveying folks in DuPage to understand DuPage's concerns in particular. And we'd like to open this up as an opportunity to have some discussion about what questions we think should be in a DuPage survey. I will say with the caveat, we would like to keep this somewhat similar to what Esperanza has already developed for a couple reasons. One, we'd like to be able to collaborate with Esperanza and share data back and forth if possible. And if we start changing the questions too much, that becomes harder to do. And also feeling that it's a pretty good tool already. So if it's not broke, hopefully we don't fix it. But that's not to say there isn't room to tailor a little bit or to add some additional questions on that folks think are of interest for us, for DuPage. I'm going to share one more thing, really to show you, while there's a lot of data and a lot of information here, it really only came from about 8 questions. So if folks want, I can also just throw up the questions so you can see what the actual questions were that generated this data.
Mimi, I want that on the screen as we talk about and give some feedback, so that would be very helpful.
There you go. I know I zipped through that kind of quick, but I wanted to make sure we had time for discussion, because I think this is really the important part of what we're doing here is how does this work for us and how do we roll this forward?
So the questions, as Mimi pulls up the list of questions so you'll be able to reference them, what we'd really like to focus this discussion on and get some feedback from the group on is the question of A, whether this survey and the questions it's asking are getting to the core of the places where we have greatest interest in soliciting feedback. We want to know what you need to know about the families that you serve and their perceptions that this survey does not address. So we can think about if there are any questions that need to be either adapted or added to get to those particular concerns. And then we'd like to be able to have some time to talk a little bit about how we could launch this survey and different tools that we could use to distribute it widely. one of the things, there was a discussion in the chat where Janice had asked very wisely, like, where did this, who was disseminating and how was the survey being disseminated? And that's a relevant question when you think about who is responding. So this was a healthcare provider that was launching this tool within existing and active patients. And so the fact that those folks responded very favorably to healthcare as a trusted voice may be true and may also reflect something about the population that was being surveyed. We want to make sure that we're mitigating those effects by ensuring that whatever we do to distribute it, it gets to as many people as possible, and we can use all of the different tools we have at our disposal. Mimi, we still can't see the questions. So
I'm sorry.
Need
Hold on.
a need to.
I'm going to try a new share. Hold on a minute.
Okay.
You have it now?
Yes.
Yes,
Okay.
thank you so much.
All right.
We may need to minimize just a little bit so we can see all of it on the screen. But
Yeah.
First, feedback from folks about whether or not the questions that this survey was asking got to the heart of what they needed to know, and then also, of course, anything that seemed like it was missing.
Kara, the health provider who was asking the questions, who was this person? Hispanic or Latinx or white or what?
This was a tool, but it is Esperanza Health Center, which serves a substantially Latinx patient population, I believe in the Pilsen neighborhood. So this is certainly a place where bilingual providers are available and where they're providing care to a lot of low-income, uninsured and underinsured patients.
Do we know, so there was different providers asking the questions or taking, were they using some kind of computer or what? I'm not clear on that.
A computer, yeah. This was not an individual asking these questions. I believe it was put out through either their electronic health record or another mechanism, because they got north of 1,000 responses in a week. So they were definitely using technology to support its administration.
Okay, thank you.
You know, Kara, this is Nicole with Advocate Aurora Health. So this looks, my first thought is this survey looks pretty long to me for some people, I think. And I think some of these questions on here, like when I read question number 3, what questions do you have about the vaccine? I don't know that having that be multiple choice versus just open-ended response from them is the best option, because we ran a listening session in Spanish in Chicago for that, and we asked that same question and just let people answer. I'm afraid that some of those responses might be leading them in a certain direction that they wouldn't necessarily feel that they hadn't seen those options. Does that make sense? Versus just asking somebody and they can kind of just respond based upon their personal feelings versus reading the actual options that they can circle. Does that make sense?
It does. I worry sometimes with some of these long questions because I know that oftentimes people are using mobile technology to complete the survey, and it can be very hard to display all of that on one screen. Yeah. But I also worry about our ability to analyze the data with any timeliness. And so my fear is that if we allow for a lot of free text, it will take a lot longer for us to be able to take that data and make it actionable.
Hey, Kara?
I think it's a good question.
So, hey, Kara, sorry, it's Mila. Just one thing, it looks like they allowed for other, so people could free text. I like the ability for people to be able to do that, but I feel like you have to have some kind of way to consistently ask a question and get an answer if we're going to have like 1,000 responses. You know, so at least they can capture the free text here if they need to, if someone feels important about what their concerns are.
I will add that anything that you see in blue highlight, this is my working version, if you will. So that was me adding the others. Oh, but
there you go.
It was for that reason, was to your point, if people have something other than what's on this prescribed list, then they can tell us. But I do echo Kara's concern. I think it's a trade-off of if we want just that free form answer, we could do that, but it will take a lot longer to analyze and turn around into an actionable format.
Yeah, that's understandable. One of the things that we heard most from our Latinx or Latino population in Chicago is that the fear of being tracked, and I just don't see that as an option on here. So, I mean, I just want to open up the options to where people feel like they have the freedom to really submit what they're truly concerned about versus being restricted to a list. I get that it's harder to come up with data, but it's just, yeah, I feel like it could be restrictive. I do like the other option, but I hear your concern about being able to analyze data if it's too many open-ended questions.
Or you know, maybe a corollary to that is maybe there's a survey and at some point there's, you know, a focus group or something like that where people can just free respond.
Nicole, I hear the same concern though, and I agree with you that it feels like it's a miss on this particular tool that wasn't called out specifically, especially given the population that we're being surveyed.
So we could add that.
Yeah, we could, absolutely could. Are there any questions that are sort of grossly missing from the survey, things that we would want to add, not J's or K's or L's, but rather a whole swath of question that we might need to think about including either something that's specific to our community or something that's specific to a particular population?
Hi, these are great questions, and these are questions that I actually often hear from some of our employees. We're just about ready to send out communication to our employees to encourage them to get the vaccines and all that. But on the flip side, is there like a playbook, answers to these questions that you have? I just joined today, so I may have already missed that. So I'm just wondering if there's something that, you know, we can share. And thanks, Chris, for inviting me to this group.
I think that's a great
very
idea.
Informative. Yeah, it's like a playbook.
Like in terms of the questions, if we had at the end of the survey, thank you for completing this survey, answers to some of these questions can be found at this link. And then, for example, what questions do you have about the vaccine? List all of those options and provide answers there. It would be an additional tool for the folks who took the time to complete the survey. It wouldn't stand in for the other education work that we want to do. But why have someone leave the survey tool without having an answer to a question that they've just identified that they have?
Right, yeah.
Yeah, it's great. It's a great idea. The other thing that we thought about was that we would like to be able to include an optional sign up by either text or email. This is intended to be an anonymous survey. So what I'm offering here would come at the end of the survey and would say, your answers to this will be kept anonymous. However, if you would like to sign up for additional information about upcoming educational opportunities, or you can enter a text number or an email here to be added to those informational outreaches. It again seems to me like if you've got someone who's engaged enough to sign on to complete the survey, why we wouldn't extend that invitation at the end seems like a loss to me, especially if we're planning on launching, for example, town hall events that these same individuals might be interested in attending, to be able to let them know when that event has been scheduled so that they can join us if they're interested.
Cara,
knowing that we're out of time. We had a hard stop at 3:15, Dave. My last question, and could distribute it as a question to the group for some feedback, because it really is important, is thinking about all of the different creative ways that if we created this survey in multiple languages, we would be able to distribute it out widely to the community. So rather than trying to launch that discussion with -1 minute left, I will craft it in the form of a question and ask Mila's help sharing it out to the group so we can collect all of the creative thoughts about how that might work.
And Kara, what I'd like to do is suggest that we make sure that we address the questions that are in people's minds now about this tool, and then we're going to negotiate a way to work through the other items and close off today. but I wanted to invite Reverend Miguel. You had a response, and if there's anybody else who's, now that this is fresh in your mind and you've looked at this, it's a good time to give that feedback.
Yeah, thank you. I got some concerns, about how can we answer this survey, because I just want to see the translation in Spanish. If people understand that question, and if they're comfortable to respond these questions, I'm thinking about where or who's going to ask this question, how they're going to get surveyed, because I don't think the Latino is going to attend in the townhouse or one of these workshops or respond these surveys. So this is a concerns too, because I know there's a lot of, besides first concerns from the people, they don't trust, and they don't have the answers. This kind of feeling is pretty hard to express, but they carry with these feelings. I don't know if you get that, I think this survey is very helpful, but again, how can we make more effective this survey as a tool, this is something we need to thinking about or review, before to use. So this is my thought.
Thank you.
Pastor Miguel, I understand exactly what you're saying. I worked in a food pantry for a number of years, and we had about maybe 40–50% Latina, Latinx population. And there was a huge trust issue in that if there were no Hispanic counselors there, they generally were silent. They would not respond to much of anything. And I asked one of the counselors why, and he explained just what you said, trust. So we've absolutely have to find a way to reach in a trustful manner the Latinx population.
Thanks, Jan. Other feedback to this framework?
One quick thing, I think some of these questions are leading, and I'll look at this and give you my feedback, but we want to not inject our own biases here, and we need to just kind of work on, like, I would strongly consider, no, I would consider getting this vaccine if I were asked by A, and then list the different people. I would take out strongly consider. And there's some other areas, as someone who's helped written surveys before, I want to make comment on, but I can do that later.
And Kara and Mimi, what is the best way for that feedback to come now?
I think that the best way, since we are out of time, would be for us to launch a message out to everyone that was participating today with some of those summary questions, and really invite your feedback. Separately, if you feel like it's easier to have that conversation in person rather than to write all of that down, please feel free to reach out to either Mimi or myself, and we can certainly collect your feedback that way as well, whichever way is easier for you.
Very good.
And we can attach those questions here so people can comment right on a document or whatever's easiest, and the slide deck as well.
Yeah, in the follow-up, we will send a copy of the questions as well as that slide deck, so that you'll have both of them as reference as you're giving feedback.
Very good. Thank you.
Thanks, everyone.
This data is incredibly helpful and illuminating. Thank you for that too. What I'm going to suggest is that I want to invite Sima and Phil. Both of you have events that are upcoming, and I want to make sure we don't close the meeting off until you've had a chance to describe what those are and help us understand how to promote them. And then I think what we'll agree to, I want to ask Mila and Kara if we can agree in our follow-up email to provide the updates that were on the agenda. So let's see. Phil, are you with us still?
I
have
am
an event?
with you. Thank you very much, David, and good afternoon, everybody. Phil Gipoko with the American Heart Association. We have announced this week that the AHA, our Chicago office, will be leading a COVID-19 vaccination community conversation on Wednesday, February the 9th from noon to 1 p.m. Central Standard Time. It will be in English. There's no charge. We have a flyer with the web links. We also have Facebook and LinkedIn links for individuals who also want to go through that route as well. So we will have that, and I believe it may have already been sent out to the entire team. Yeah. Something for us to think about is my executive director, Lisa Hinton, who's a resident of Wheaton, would be more than happy if the opportunity is to come out and join this and talk about this conversation and what her and our board needed to do in order to have an effective conversation with our communities, how we're able to get the healthcare and research professionals on board to make this happen. If this group wants to have that similar conversation with the great healthcare and professionals we have in DuPage County and really localize something. So if that's something that's needed, we'd be more than happy to bring in Lisa for a couple minutes, talk about the logistics, and we hope to see everybody join us as well. Thank you.
Hey, Phil, it's Mila.
Yes.
You had shared earlier a link to a video that AHA had done, and I think one of the nurses that spoke was a DuPage County resident.
Yes, I believe. Yeah, absolutely. I believe Gloria Barrera. She is a one of the nurses at one of the Downers Grove, or the entire school district. But she happens to also be the president of the Illinois School Nurses Association, as well as a member of the National Association of Hispanic Nurses. I think she's on their board, and she's a longtime AHA volunteers of ours. But yeah, Mila, she's local.
Yeah, we would be good to engage her too. She did a really nice job on that video, so thank you for sharing it.
Absolutely. Thank you, and happy to make that connection when and to who we need to do that.
Thank you.
Thank you.
Phil, we just saw a survey that had the doctors twice the impact in terms of inviting folks to the vaccine than anyone else in the world. So it's so timely that you've made that invitation. And I know we're going to find a way to follow up on that. I don't see Sima with us anymore, so I do want to address your attention to the chat where she placed an event that will be Facebook Live happening tomorrow night. I'm not familiar with the event, if anyone else is and could describe it, but if she's put it in there, I'm imagining that it's just the thing that we're going to need to help us reach all of our community so no one is disadvantaged. All right. Is there any other urgency that we should speak to or address before we close off today? Fantastic.
Hey, Dave,
yeah.
Let me just, as a kind of a preview to the update we're going to send on the last two items that Karen and I will put together. The health department will have some updates on the mass vaccination clinic and our expanded capacity that Chris alluded to earlier, and find ways for Heart to be involved with that. And then also at the communications subcommittee, we had the opportunity to kind of talk about some different opportunities for PSA. So that's just kind of a teaser. We'll send some follow-up information next week. Thank you.
Very good. And here's my teaser in the follow-up for the discussion on who's missing from this table. We heard some really helpful ideas through the meeting today. We heard about primary care doctors, FQHCs, Spanish language media, older adult representatives. Mary, you're with us, so you ring that bell as well. So I will be asking you to think about that from a supply side and a demand side. Who could help us here that we need at this table? Thanks so much for your time and for your input and for your vigorous discussion. We're getting stronger and stronger, and I thank you for that. And so let's, would you prefer to go 2 weeks or 3? Could you give me fingers on what your preference would be? 2. All right, we'll reconvene in 2 weeks. Thanks all, we're adjourned.
Thanks, Dave. Thanks, everybody.
Thanks,
Thank
everybody.
you.
Everyone.
Thank you. Have a good weekend.
Have a great weekend.
Enjoy the snow.
We will.
Next meeting is October 17th. Isn't there another meeting on February the 17th?
I'm not certain the date, Sophia. But we'll send it out 2 weeks from now. If that's February 17th, nope. I think the meeting will actually be sooner than that.
Okay, because I
My
saw
math.
flyer, it says February the 17th.
I think it was discussed, but I think we may be looking at another date now based on the need to connect more quickly so we can get some of these pieces in motion.
Cool.
We'll include it in the email that goes out though, for sure.
Thank you so much, Kara.
Thanks. Have a great day.